It's always a hard gig straight after lunch. So hopefully everyone has had their caffeine and is ready for this afternoon's session. So I first started my intern years under the tutelage of Rob Boy. So I was really privileged to be alongside him at Royal Children's. Not so privileged to see a lot of vaccine preventable diseases like Haemophilus, meningococcal, that are now vaccine preventable. Back then, giving away Rob's age and my age, but they weren't vaccine preventable. So after doing 4 or 5 years in peds, I decided to go to general practice. And it has been one of my passions, promoting vaccination uptake to patients, to healthcare workers, and to the wider community and politicians. My speaker declarations are that I've received honorariums from GSK for immunisation education sessions. Does it want to work? There we go. Sorry, technology. So Primary Sense is the bespoke digital tool that we developed on the Gold Coast PHN as part of an innovation grant from the Department of Health. It's a population health planning and management tool, so we can see macro level data. It's a risk stratification for regional and practice level populations. It's clinical e-decision support at the point of care, where GPs get prompts as they open the patient record. There's high quality data and reporting that are easy to use and seamless to use and can be downloaded in the general practice. It uses the Johns Hopkins Adjusted Clinical Groups tool, which has been in place for about 30 years and around 20 countries in the world. And it's evidence-based ways of assessing risk banding in population groups. And it's got strong clinical governance. We started this in 2017 with Professor Morgan, myself, Carl DeWitt, and Evan Ackerman. And it's now been rolled out nationally. And you can see that there's a wide variety of representation on the clinical governance group to ensure that data is used appropriately and only for CQI purposes, not for Big Brother type purposes, so that GPs are still happy to buy into having their data uploaded to primary health networks. It's got strong data governance. It's at top level industry standards, congruent with RACGP standards. Only de-identified data leaves the practice. It leaves the practice every 5 minutes, so there's not whole patient records. And it is stored at the PHI, which is the Primary Health Insight platform, which is controlled again with industry standard protection and regularly tested for cybersecurity breaches. We know that there's gaps in immunisations. We've heard that. We've heard that influenza immunisations are not necessarily reaching the highest risk groups as they should be, like antenatal patients and patients with severe multimorbid diseases. So we know the best evidence is that if we can get healthcare professionals to recommend a vaccine, that improves the uptake. And we've heard that from our previous speakers today. The evidence for the response to prompts has been analysed. This was a study that was done in the Australian General Practice Journal by Carl DeWitt, Mark Morgan and Debbie Davies. And it was done during the pandemic in 2021 for 6 months from January to December of 2021. And really it did show that GPs responded to the prompts on average for 20%. So the prompts are not just for immunisations, they're also for things like care planning, cardiovascular risk assessments and medication alerts. We found that with the immunisations, there was about a 75% response rate to influenza immunisations at that time, even though the GPs were super busy rolling out the vaccine and rolling out pandemic measures. So it showed that prompts do work at point of care, and that if we can deliver filtered prompts to GPs while they've got the patient sitting in front of them and they're opening the record, things do get done. This is a bit of a graph showing the usage of Primary Sense for the last month across the 11 PHNs that are currently using Primary Sense. You can see the top 20 reasons for visits to a GP are listed there. And the second one is immunisation. And if you aggregated immunisation with COVID vaccinations as well as shingles vaccination, you can see that it would have been the top reason for visit in the last month for the PHNs listed there. It's a little bit of a lag, sorry. This slide shows that for the last month, COVID-19 infection was in the top 10 of conditions in all but one PHN. Upper respiratory tract infections and COVID-19 vaccines were in the top 10 for 7 out of 9 PHNs and the top reason for 2 PHNs. This shows what's possible at a national level. Currently, for primary sense, we're uploading about 11 million unique identifiers each night, and it's updated every 5 minutes. So it's real-time data. And you can see the rate of COVID infections across the different PHNs listed there, mainly in Southeast Queensland. The purple line is Sydney North PHN. And then if you see that it was overlaid with the Doha 7-day admission to hospital rate, you can see that it pretty much does show the peaks and troughs. So we can show that even in real time, we can see emerging trends. Before COVID-19 was even a possible code in our practice software, because it was a PHN tool, we were able to ring the computer programmers and say, hey, we really need to be able to look at this on the Gold Coast and assess where we are going to set up testing sites, where we are going to set up the COVID respiratory clinics. And they were able to use symptom data without the coded diagnosis and be able to create heat maps across the Gold Coast in real-time data. They were also able to overlay that with risk banding so that we could see, even though there might be a high proportion of 20-year-olds going to one location, getting testing or seeing GPs, we were really worried, obviously, about the people over the age of 65 and 70 and people with comorbidities. So we were able to overlay the risk banding with that to be able to best predict where we should be setting up the clinics and where we should be setting up the testing sites. So it shows you what's possible with the rich GP data that's coming in every 5 minutes. So how does it actually work? We wanted the tool to be easy to use in general practice. We know that GPs are fee for service. They see patients every 10 to 15 minutes. It's rare that a patient comes in with one issue. There's usually multiple issues, especially if you're a female GP. No disrespect to the male gender. Often the old tools that we did have needed to be manipulated. You had to create recipes in the old tool and you had to know how you wanted to slice and dice the data. We wanted the reports to just pop up and pop up only if it was relevant to the patient. So for instance, the medication alerts that are built into the software pop up generically if anyone's got a CKD, kidney disease diagnosis. We wanted the prompts to pop up only if the EGFR got to the right rate for that drug alert. So we made them bespoke and we made them specific to that patient. Similarly, the immunisation prompts are already there in best practice for our flu shots and our shingles immunisations for over 50. So we didn't want to recreate the wheel about generic prompts. We wanted to try and target those people that are hard to reach. So people with multi-morbid conditions and people that were likely to go to hospital. So this next slide shows you how you can download it. You just click on the toolbar, download the report, and you can pick a selection of reports depending on which area you're interested in. It takes about 2 to 3 minutes to download. You can't break the tool. So I always say to my registrars, play with it, have a look at it. It is a good ability to be able to see how you're going with your data and how you're going with your outcome measures. It has inbuilt SMS functionality, so you can slice and dice the data using an Excel spreadsheet by GPs, by coded conditions, but the reports themselves are able to be sliced and diced on your computer screen. So you can look at the whole practice data or you can look at your individual GP data. This shows you a little bit about the risk banding. So the top bar graph shows the gender and age distribution of this dummy data in the practice. The bottom shows you the risk banding. So risk band 0 are healthy, no issues, and risk band 1 might have one condition. Risk band 3 might have one significant condition like diabetes. Risk bands 4 and 5 are likely to be multi-morbid, likely to be older, likely to have 2 or 3 conditions that are significant, like coronary heart disease or diabetes or asthma or CKD. And so if you have a risk band 5, you're really likely to go to hospital in the next 12 months. Usually most of those patients have a risk score 80% and above. So you can see that you can really slice and dice the data and call in those people that are most at risk. So during the pandemic, we were able to pull in our risk band 5s, give them COVID vaccines first, then risk band 4s, then risk band 3s, and so on. The prompts only pop up if they're relevant for that patient and only if the patient is in need of some care item. They have 3 things listed. Usually the highest value is at the top. So in this case, you can see that the patient needs an immunisation and they need some care planning. It will tell you what their wristband is, and it will tell you when they last had their flu shot. And you can click on more information if you wanted to go finding more information as a GP. These are what the reports look like in primary sense, and they have that SMS functionality. You can search by doctor, you can search by last flu shot, you can search by those people who are missing a pneumococcal shot. There's a winter wellness immunisation report for people over the age of 5 who have a comorbid condition that would make them more at risk if they caught flu. The pregnancy vaccination one obviously covers all pregnant patients for flu and pertussis, and the chronic lung disease and asthma is there as well, and frailty care management, and patients missing PIP-QI. For practices that are doing their PIP-QI, they get incentivised through funds from the Department of Health to do those QPIP activities. This is a little showcase of what pregnancy and vaccination report looks like. I did mine as my RSCGP CPD, and there was only 2 patients that were outstanding for the immunisations, and they were both healthcare workers, so they got the SMS text, and we got up to 100%, which is a nice outcome. This shows you what the winter wellness report looks like, and you can see, you can find those people that had a flu shot last year, so you might pull them in for a junior nurse starting at your practice because they're likely to accept. You know, they're not going to be unlikely to be vaccine acceptors. For those that haven't had one ever, you might want to have a dedicated clinic with some more resources and more time set aside to be able to try and convince them to have their flu shot if they haven't had it before. Practices, as I said, were incentivised for doing QPIP activities, and so there's bespoke CQI templates that they can download and use the Primary Sense data tool to complete their QPIP activities. This is a little showcase of the 2023 data, and it shows you practices where most of the GPs have got the app, on average, immunise more than 40% of their complex patients against influenza. They also recorded smoking on average 20% more often, and the data was collected last year during July. And you can see that at July, 65% of the high-risk patients had had their immunisations completed. This shows you the data on each PHN and shows you that about 24% were completed on the day, another 48% were completed by 2 weeks later, and 62% were completed 4 weeks later. You know, sometimes the patient's not ready to have their flu shot that day, or you might not have the ability to immunise them time-wise, and so often it might take 2 to 3 weeks from a healthcare provider's recommendation to get them back for immunisation. You can see Brisbane North were a star PHN. They got 81% of their at-risk population vaccinated by mid-July. They did roll out in April, May, and they had a lot of promotion and a lot of education sessions to be able to teach their GPs how to use the app, but also the importance of capturing those high-risk groups and making sure they were vaccinated. So this shows you Primary Sense data for Gold Coast PHN for 2023. We looked at the 5 practices with the highest influenza immunisation rates, and we looked at the 5 practices that had the lowest immunisation rates. And you can see that For those that had no prompts with primary sense, they immunised 42% of their patients over 65 for influenza, and those that had the prompts immunised up to, I've got to look at the data. So yeah, 42% versus 30%. And you can see the wristband breakdown. So you can see that for wristband 5, there was 63% immunised if you had no prompts, 71% immunised if you had prompts. So about a 10-12% uplift. And Gold Coast was going through the transition of version 1 of version 2 of the data tool. And so probably about 30% of practices at any one time weren't getting their prompts in July and August due to the changeover of technology. So this is just a quick 2-year comparison on the Gold Coast, showing that how much vaccination work is happening in primary care. In 2022, there was 558,000 vaccinations, and in 2023, there was a drop-off of 351,000 to 351,000 vaccinations. And we felt that was mainly due to the drop-off in COVID vaccination numbers. Patients visiting both years were about the same at around 888,000. And you can see the trends for vaccinations. So you can see the upkick in the shingles vaccination due to the introduction of the vaccination for Shingrix. And you can see that travel vaccinations also increased. So if we look at the percentage of patients in each band immunised, there have been a general drop in the influenza vaccinations from 2022 to 2023. And we put that down to some vaccine hesitancy, some drop-off in influenza vaccinations that might have been accounted for because patients go to pharmacies, and this data can only extract the data from the primary care record. On our wish list, we hope that we'll be able to get AIR data integrating into our health records. So obviously we know immunisation rates are dropping across the country slightly, but we can see that by 2 years, and 2 years is the lowest drop, 5 years they are back up to 91.6, which probably says it is just more patients forgetting to complete the vaccination schedule rather than being not wanting to. I'm just going to skip over these slides in the interest of time, just showing you macro level population data is available so that you can help with politician planning, health and hospital health service planning, and you can then use that to inform best outcomes for macro level data. So key take-home message: code, use prompts, turn them on, ask your PHN to use primary sense. Future is MEN-B, prompts are coming, and children under 5 prompts are coming. And resources are listed there. Thank you.